We're at the Hilltop Pet Clinic, and I'm with Dr. Brandon Beebout. We have a very special guest joining us today, Jared Miller and his dog, Harley. Good morning, guys.
How's it going?
Okay, so it's going great. Talk a little bit about Harley's story.
Well, Harley, I got her from a couple in Omaha, and I brought her back and was gonna take her to my local vet clinic and get her shots and stuff. And then the vet had noticed irregularities in her breathing. So she had me listen to the heart and said that there sounded like a murmur. So I was like, okay. I just politely said that I'm gonna get a secondary opinion. And so when I came here to Hilltop and Dr. Beebout saw her, and he says, yeah, this dog has it's a pretty severe heart murmur. And he said, this is kind of like what we need to do. And he said, you should get in touch with K-State down there at Medical Center. And he set all that up stuff. And then she, was it December 27th,
Yep.
she had her heart surgery.
Okay. Is that typical for a dog to experience a heart murmur?
It's actually pretty rare. So,
Okay.
especially in this breed, and obviously at this age, we call it congenital, so I mean present at birth. And
Okay.
so she had actually a couple different abnormalities with her. She had something called a PDA, patent ductus arteriosus. Essentially, when we come out of mom, the first breath we take, that ductus closes before it was taking the blood from the right side to the left side of the heart, because we had no use of our lungs because we weren't breathing oxygen. And as soon as we take that first breath, that duct closes.
Okay.
Well, in her, it didn't close. And so now we still have this shunting of blood back and forth, despite some of the blood going to our lungs. And so now she's relying on her lungs to oxygenate the blood. So she's taking deoxygenated blood and sending it to the rest of her tissues. And so exercise intolerance, I think, was one of the first things that Jared had mentioned. She'd just go outside, go potty, come back in, and she'd be tired.
Okay.
She also had another abnormality called persistent right aortic arch, PRAA, where there's a little band of fibrous tissue that essentially kind of constricts and strangulates the esophagus. And so she has something called mega esophagus, where there's a kind of a pooling of the food in that esophagus, so she kind of eats upright for that too. And so what they did, they go in there and they ligate that vessel, and then what they kind of attempted to do is try to tease off that fibrous tissue. They weren't successful necessarily with that yet. We can always go back in later, so she does still eat upright. But as far as her heart, the murmur has since ceased. She goes and plays ball, and she's no exercise intolerance, and she's going to live a relatively normal, happy life.
Now, is this something that when we first bring our puppy into you to see him at their first visit, is that something that can be detected?
It absolutely should be detected.
Okay.
And so that is exactly why our first puppy exam is so important. We're looking for everything congenital. Is it an umbilical hernia? Is it a cleft palate? Is it a heart murmur? And so we can see reproductive changes. And so that's something where that first 45-minute new pet exam is so important, because if we don't detect it, and hers was pretty obvious, it was a pretty loud murmur, but sometimes they're a little bit more inconspicuous. And so that is our job to find that out, because as we know, it took a month even just to get into the cardiologist. And so it's one of those things, earlier is better, because she only had months before she was going to get herself into trouble. And so we nipped it in the bud and got her down there, and they did a wonderful job down there in Kansas.
So how's she doing now, Jared?
She's been pretty good. Like, she drags me around the yard. She's always wanting to play ball. She's after a squirrel, and then if there's a rabbit, she'll go after the rabbit. Yeah, she just has a lot of puppy in her. Which is good.
And she's a beautiful puppy.
Thank you.
Beautiful puppy.
Definitely very beautiful. I've always wanted a German Shepherd.
Jared, we're very happy for you and Harley, and thank you, Dr. Brandon.
Of course.
Stay with us. We'll have Pet Doc coming up next Monday.